Hi folks, I'm Rich Lucy, Senior Prevention Program Manager here at the Drug Enforcement Administration's Community Outreach and Prevention Support Section. Welcome to this episode of Prevention Profiles Take 5. A couple of firsts going on in this episode I'm really excited about. First of all, this is the first time that we've had our guest in the studio with me, so that's exciting. And secondly, it's the first time in quite a while that we have actually interviewed a director of the Center for Substance Abuse Prevention. So let me introduce you to Captain Chris Jones. Captain Jones is the director of CSAP, the Center for Substance Abuse Prevention. He brings a wealth of experience to SAMHSA, having led substance use, mental health, and injury and violence prevention policy, program, and research activities for more than a decade. Prior to becoming CSAP's director, Chris served as director of CDC's National Center for Injury Prevention and Control. And in this role, he provided strategic leadership, scientific leadership, and overall management of the center, including driving the center's strategic direction and advancing the center's priorities of preventing drug overdose, suicide, and adverse childhood experiences. During his career, Chris has served in a variety of leadership roles in the U.S. Department of Health and Human Services. Among these roles, he served as the first director of SAMHSA's National Mental Health and Substance Use Policy Laboratory, as Acting Associate Deputy Assistant Secretary for Science and Data Policy, and Director of the Division of Science Policy in the Office of the Assistant Secretary for Planning and Evaluation at HHS, and Senior Advisor in the Office of the Commissioner at the U.S. Food and Drug Administration. And with that, Chris, welcome to the podcast.
Thanks for having me.
Yeah, it's exciting for me because, as I've said on this podcast many times, prior to me coming here at DEA, I was a special assistant to the former director of CSAP, Fran Harding, and it was during that time, it's actually how I met Chris, through some initiatives that CDC and SAMHSA were working on together, and so this is kind of a nice full circle moment for me. So, Chris, let me just jump right into it. First, let me start with congratulations in your new role as CSAP's director. What is your vision for CSAP, and in particular its efforts to prevent drug use and misuse among college students?
Yeah, well, really appreciate the opportunity to be here. It is an honor to lead CSAP. I am certainly following in the footsteps of many prevention pillars who have done so much work to advance prevention in communities. For me, stepping into the CSAP role now, really just first thing was to sort of take stock of where we are, right? So we have a very toxic illicit drug supply. We have rising numbers of overdose deaths. And really, when you look at what's going on in communities, drug use has never been riskier. Mm-hmm. Whether it's your first time that you're using a substance or somebody who has a long-standing substance use disorder, we see that because of illicit fentanyl and counterfeit pills that are just commonplace in communities, that anytime you're using a substance, there is risk that maybe didn't exist even 5 or 10 years ago. So when we think about prevention, we really have to think we have prevention science on our side, we know what works, but we also have to be open to doing things differently to meet the moment in which we're in. And so for me, a key priority is being data-driven. How are we assessing what's going on in communities? How is risk changing? Who is at risk? And then what are the strategies that we need to put in place to help communities make progress in our prevention work? The other part is really elevating the conversation of prevention. So a lot of the focus over the last 5 or 6 years and a lot of the money that has come out has been around treatment and focusing on recovery, and those things are absolutely necessary because of historic numbers of overdose deaths. But if we really want to get ahead of these challenges, we have to go back to the prevention. And how do we prevent initiation in the first place? How do we prevent people from progressing if they're using substances? And then how do we keep people alive? And I think that is our opportunity. It's really our moment. And when we look at college-age populations or young adult populations, we really do see that that is where a tremendous amount of risk exists. When you look at CDC's mortality data, people in that age range, somewhere between 1 in 4, 1 in 3 deaths in that age range are due to drug overdose. This is something that's not happening on the margins of society, but it is happening in communities across the country. And there are unique aspects to college-age populations. You're going from a very structured environment when you're living with parents or some other caregivers to having a different structure, different peer influences. And there are so many opportunities for prevention in that space, not only to address the urgent issues of overdose, but also to make sure that we're setting people up for success throughout the rest of their life. And a lot of people think prevention is focusing on middle-aged or high school students, and absolutely we want to do that. But when you actually look at when are people initiating substances, it's not just in those high school years. It is really in that 18 to 25 year age range, and you see the highest rates of substance use among those populations. So to me, it's a natural place. If we're going to be data-driven, where does the risk exist? Where are there opportunities for prevention? So it is a key part of our work in thinking about elevating prevention, elevating partnerships, thinking about who should we be engaging with, campuses, college-age students, young adults during that transition period. There is a real opportunity there, and that's part of our work moving forward.
Being in the chair that you're in, it's such a momentous occasion in terms of the prevention landscape. And I know that you have actually sat on panels with our administrator, Ann Milgram. She has talked about DEA meeting this moment, which, as I said on this podcast many times, my entire career at the government level, 33 plus years or so, illicit fentanyl and fake pills has changed the landscape significantly. And it's interesting how you have also, you align with that message so well by saying this is a moment that needs to be met, in
Right.
terms of where we are in prevention. I want to switch and talk a little bit about data for a bit. And I got to tell you, whenever I see you present, I've always appreciated it because I know you love data. You talk data very much, but you are so relatable in the way you talk about data. It's not like way up here. And I think that that's important for people. I think some people want to run from the data because they're afraid of the numbers. And I think you really have to embrace the data because, as you've said, and I've said it plenty of times, data drives programming, right? So SAMHSA oversees administration of the National Survey on Drug Use and Health, hot off the press. It came out the latest data this week. And many stakeholders in prevention, including DEA, they look at the NSDA to see current rates and trends as it relates to drug use among various age groups. What are some of the latest key findings from the survey, especially related to drug misuse among young adults, that should be of concern to colleges and universities?
Yeah, so the NSDA data came out earlier this week, and you can go to the SAMHSA website to get more data than you could ever want. Hundreds of detailed tables that really do break down what is happening in communities, whether it's by age group, by race, ethnicity, geography, socioeconomic status. And I totally agree with you that data help us tell our story. Now, we have to be thoughtful about how we contextualize the data and use it to tell the story, but it is essential. And when we look at like the 18 to 25-year-old age group, which is a common way that the NSDA data are cut, to look at 12 to 17, 18 to 25, 26 and older, 18 and 25 clearly, and it's been longstanding, have the highest rates of substance use really across all substances. You tend to see also higher rates of use disorders. And so for 2022 data, the trends are, we have some challenges with trends in NSDA because of COVID-related changes and changes to the survey. So we don't have a long time horizon to look, but we do see as sort of a top line that illicit drug use in the past year went up among all age groups, 18 to 25 being a particular group that's driving some of that increase. But really that increase is driven mostly by 18 to 25-year-olds using cannabis in the past year. When you start to look at other substances like prescription opioid misuse, prescription stimulant misuse, heroin, LSD, methamphetamine, the rate, at least the year-over-year change is pretty flat. No declines, no increases, which is certainly encouraging, at least over year period. But overall, again, we see that is, again, a high-risk group who's engaging in substance use across all substances. One statistic that I was looking at this morning from sort of the annual report that tries to package the data in more useful ways, I would say, as opposed to just detailed tables. Among 18 to 25-year-olds, nearly 50%, it was like 48.5%, had a mental illness or substance use disorder in the past year. And I really do think that that is emblematic of the challenge that we face among young people, young adults, and it's really our call to action of how are we supporting those individuals? What are we doing on college campuses, in workplaces that engage with young adults as parents, as caregivers, as community members? If 50%, 1 in 2, 18 to 25-year-olds in the United States had a mental illness or substance use disorder in the past year, we got to be doing more, right? We got to be figuring out how do we help support these young people to be successful, because counterfeit pills, very common in communities, on college campuses. People may think, oh, I got this Adderall from my friend, I'm gonna take it. Well, in fact, it may be a lethal dose of fentanyl. And so how are we helping to support and raise awareness? And to me, that one statistic was really eye-opening and a call to action. And I think probably most people in the public wouldn't know that 1 in 2, 18 to 25-year-olds was struggling to that degree.
You know, it's funny you mentioned the mental illness connection. When I do my presentations and such, I usually offer up the data points on the mental health of college students. Usually those data come from the National College Health Assessment through the American College Health Association. And the reason I started doing that was through my time at CSAP and working with our colleagues in the Center for Mental Health Services, and knowing how closely aligned those two issues are. And when I talk to health center and counseling center directors around the country, they'll talk about students who present in the centers, and the student will say, well, I'm feeling anxious or depressed, therefore I'm turning to alcohol or other drugs. And yet they'll also say that their alcohol or other drug misuse is causing them to feel anxious or depressed. And so I always talk about this bidirectional kind of influence on so you really have to talk about one. You have to talk about both. You can't talk about one without the other.
Yeah, I agree. I mean, every presentation that I've given in the last several years, there's at least 2 or 3 slides that talk about the intersection of mental health and substance use. And then even stepping back as we think about prevention, what are shared risk and protective factors that can influence both mental health and substance use? And I always put up a slide from the National Survey on Drug Use and Health that shows that people who are struggling with mental health challenges have higher rates of substance use regardless of how you cut the data, regardless of substance. And again, thinking about the current context, that means that that use is riskier than it's ever been. But I also appreciate your point that it's not a one-way street. Often people will say, well, people are using substances because they have underlying mental health condition. Well, for some people that may be true, but for others, their own substance use may be driving anxiety or depression, or people just feeling stuck or having low well-being or poor, you might categorize it as poor mental health. And so when we think about prevention work or early intervention work, we really have to address those things in tandem if we want to truly address what's going on with the individual.
So I have a follow-up question where I want to kind of delve into your pharmacology background, talking about, and you just mentioned, one example of, say a student scoring an Audi from a roommate or a teammate or something. Prescription drug misuse among college students also is a concern. So what should campus-based prevention professionals and the students be mindful of on this issue?
Well, I would say the first thing is that you have no idea what is in the pill that you think you know what is in the pill. And I think that's the core message that 5 years ago we weren't really even needing to talk about. Right? It was generally that if you got a pill from somebody, it probably was from a pharmacy. Still diversion, still misuse, and probably not needed, but you at least had some sense that it was what it was. Whereas now it is very clear in communities that Adderall, Xanax, prescription opioids, more often than not, are counterfeit pills with pressed fentanyl or some other synthetic drug. They're not what you think are quality control products somebody's getting from a pharmacy. So one is we have to raise awareness about that among students, and as peers, raising that awareness among your peer students, certainly among administrators, people, RAs, other folks that are engaging with students, teachers, raising awareness that that is the reality of what's going on in communities, and have things like naloxone available. Again, several years ago, we weren't talking about naloxone in schools,
right.
But we have to. We have to, because that's the reality of what's going on. And I mean, I live in Atlanta, but I'm also up here in DC, and in both cities, there have been recent reports about overdoses on campuses, and a need to shift to, raising awareness about having naloxone, understanding how to respond to an overdose, and that is something that just should be very routine. I think the other part is just recognizing that there's also a lot of misinformation or inaccurate information about the benefits that a student might get from using certain substances.
Right.
So, I mean, I think, stimulants are a great example where people believe that it's going to help them study or improve their academic performance, but really study after study show that if you don't have an underlying ADHD condition, there really are not benefits to using those substances. And in fact, there can be real harms from using those substances. I mean, the same could be said for benzodiazepines like Xanax used to treat anxiety. It's not really helpful to self-diagnose and say, oh, I have anxiety and I'm going to get Xanax from my friend, because there may be something else going on that a clinician needs to assess, and that it really may hold an individual back from achieving their potential because they are going down that route of sort of treating themselves. And again, that's in a context of illicit substances that are not what you think they are. So I think across the ecosystem of campuses, there are opportunities to ensure that there are pathways for kids who are struggling to get help, that you're creating norms in that ecosystem that it's okay to not be okay, and that if you need help, no questions asked, you can get that help. But we also are fact-based and real with individuals that the illicit drug market is toxic. This could kill you or kill your friend. There are steps that you can take to raise awareness, but there are also steps that you can take to save a life, like having naloxone.
Yeah, there's so much to unpack there, because with DEA's One Pill Can Kill campaign, I've been saying, as we all have been saying, the universal message, no matter what audience you're talking to, is don't take a pill that's not been prescribed by a licensed provider, dispensed to a trusted pharmacy, right? So whether you're talking to middle school, high school, older adults, college students, workplace, that message is universal. And I've tied it to the college population because we know that the typical class of prescription drugs misused are stimulants for the reasons that you've mentioned. They think that it's going to help them get a better grade. And no research to indicate that that is true if you are non-medically using. The caveat is, sure, if you are clinically diagnosed, it will help you with concentration and focus, but we're talking the non-medical use.
Right.
And so, for somebody who, scores an Addy from a friend, as you said, that person probably got it from a friend, from a friend, from a friend, from a dealer. That's not a trusted pharmacy. It makes its way back to the person, and then he or she becomes one of the statistics. And so that's why we've continued to, as you've said, 5 years ago we weren't talking about this, and we get accused sometimes of this being a scare tactic. And I say, look, I've been in this field for a long time, and I know that scare tactics do not work. These are facts that are scary. The fact that 7 out of 10 of these pills seized contain a potentially lethal dose, and that's just nowhere where we were several years ago.
Right.
Let me talk about CSAP again a little bit with some of its initiatives, and there are a number of high-profile campaigns to raise awareness about the importance of preventing alcohol and other drug misuse. And I'm immediately thinking of National Prevention Week, the Communities Talk initiative, both of which have evolved over time. I know even since my time there. And we know that community engagement is fundamentally important in these efforts. So how is CSAP helping to facilitate the collaboration between colleges and universities and their surrounding communities in these efforts?
Yeah, so I think of those particular campaigns like National Prevention Week, what we've tried to stress is that it's not just a one-time thing and it happens in 1 week in May, but that there are resources that are available to jumpstart conversations in communities year-round, and that, colleges and universities can be those people who are jumpstarting that conversation, or they can be a seat at the table, recognizing that they are an important constituent of their community. I live right near Emory University in Atlanta, and Emory is not just an academic institution. They have multiple hospitals. They're a huge employer of the community, and they are a business that supports many other businesses in the community. And they really are a pillar of the community. And they're thinking about like transportation corridors and other activities. They're at the table, right? And so when we're thinking about how our communities coming together to talk about substance use, academic institutions are a natural partner for those efforts. So the National Prevention Week resources are available from SAMHSA, free to use by other people. The Communities Talk work is really interesting as I'm getting up to speed on sort of where it is currently, that it is a program that has multiple resources that are available, again, to sort of help facilitate and provide some structure for those conversations. Oftentimes there are people in communities who want to have that conversation, but they don't know how to go about it. And so, this Communities Talk can help with that. But we also provide stipends to communities to actually facilitate those convenings. And I think the stat was something like 11,000 or something have been provided over the lifespan of the program. It's not a lot of money, some $500, $750 per stipend, but it is an important place to start that conversation in communities. And so colleges and universities have been a part of those stipends in the past and bringing people together. So that's another resource that is available. The other resource I would mention is the Talk They Hear You campaign, which is more geared towards parents and kids, but also school administrators and others. And again, it is that sort of series of resources to be able to help people engage in that conversation, to really think about, I think there's something going on with somebody that I care about, but I don't know how to approach them. And it gives that sort of hand-holding, in a sense, sort of motivational interviewing and other skills to how to approach that conversation. And so at a more individual level, those are also resources. So somebody on a university who is interested in having that conversation among some subgroup or some organization within the university can also take advantage of those resources to have that conversation. Or if you're an RA, and you're stepping into that role, and I remember when I was in college, RAs are dealing with lots of different things, and you're not trained for how to talk to somebody about their substance use. So those are also resources that can be taken advantage of. And as a part of that Talk They Hear You work, we have something called Screen for Success, which is essentially a screener to help take stock of does somebody have a problem with behavioral health, substance use, and sort of what other resources might they need to be connected to. So you take a sort of very, fairly brief screener, and then it gives you information about resources that are available. And we're continuing to build and modify that so it is useful for healthcare providers, useful for school administrators, and not just parents or individuals themselves. So we've really tried to create almost like an open market of resources that make it easier, right? If you've got interest, you don't have to do all the legwork. There are resources that are available to you to help jumpstart those conversations in your community.
I'm glad you brought up Talk They Hear You because, traditionally they think of, the 18 and under, population, but we know a parent's work is not done just because their child goes off to college. And, our publication on growing up drug-free, we know the messaging in Talk They Hear You is useful for parents to still have those conversations with their child as they're going off to college, because it's never too late to have those conversations.
Yeah, and I think when you look at where people are initiating substance use, how are their changes in structures, communication and parental support, even though it may feel like you're on your own, you're an adult, and parents may want to have, appropriate boundaries to let people be adults, that's still a very important relationship and important as a protective factor in having kids feel supported, that there is an open line of communication. You think about those transition years when people are going to college, there are a lot of firsts that people are experiencing where, whether it's mental health or substance use, may come up in those situations. And, you may still be developing your own peer network, and your parental network may be the thing that you really fall back on. And so having parents feel comfortable in those conversations, even as kids transition into adulthood, is really important. So that when that time comes, parents are not trying to figure it out in the moment. And so I have a 10-year-old, and I'm signed up to be a parent for life. I get it. I know that things will change, but I think it's important now in my relationship with her to start having those just conversations, right? We're building that trust that whatever it is, we can talk about it, right? And it's not going to be it's going to be from a place of compassion and empathy and respect. And there's obviously those things change as they get a little older, but I think the skill set that's there and what they hear can help is to help parents feel comfortable in those conversations that would still be applicable even when kids are in college.
I also like the fact that you mentioned it really isn't only for parents, and we have said this in the Growing Up Drug-Free publication. It's really anyone who comes in contact with the child, and so in this case we'll insert college student. So you mentioned an RA or an RD or a teammate or a classmate, is finding ways to prepare yourself to have those conversations if you are concerned about someone. On our website, we have in the Student Center how to talk to a friend, and we talk about prepare and proceed, and then follow up. Don't just end it. So I think that's important. It's not just for parents. I think there are other avenues for other people.
And I do think that, especially among 18 to 25-year-olds, your peer network is really the place that people are seeking connectedness, that are setting norms within their social network. And so having people who are comfortable in having those conversations, that have the skills to navigate that when somebody does raise it, is really, really important. I mean, it is something that really will save somebody's life. And I think that creating resources for that population and supporting healthy peer relationships and norms in different communities, whether it's a college community or even some subcomponent within a university, is really critical for addressing the challenges that we're faced with now. I mean, I remember my time in college, people would share lots of things, and often they would get terrible advice, right? But it's sort of like, oh, well, you're my friend and you seem smart and I'm going to trust your advice. Like, if we hope that people can be informed in their advice, so we want to create resources that can help facilitate those conversations.
Absolutely. So now I'm going to really take a turn here and switch the conversation and talk with you a little bit about harm reduction. And I often say, I've been talking harm reduction or risk reduction within the college population for years. Because that setting has embraced that strategy for a while. However, I often say that now it is a seismic shift for the government to be talking about harm reduction, because we hadn't for so long. And so I also get the sense through observation and meetings I've been in and conferences that I've been at, some people view harm reduction as the panacea, as the be-all, the end-all, solve-all issues. And we know panaceas don't exist in prevention. Where do you see harm reduction? And I know, so the both hats you've worn, both CDC and SAMHSA, have been leading conversations and grants around harm reduction. Where do you see harm reduction fitting in along the continuum, especially as it relates to primary prevention?
Yeah, I think it's interesting. I mean, there is this natural tension that exists in the field of where prevention, treatment, recovery, people have sort of I get those things, and then harm reduction.
Kind of like solid lines.
Where does it go, right? I mean, and I would venture to say that prevention, treatment, and recovery is also not so black and white. And that engaging with the recovery community is an important part of how we think about prevention, because there are people who have been down that road, who have particular insights that others don't. And treatment and recovery also not black and white. So for me, I think first I want to be very clear that preventing the initiation of substance use, primary prevention, absolutely important and critical for our work, and CSAP in particular. And any work that we do on harm reduction doesn't take away from that, right? We can do both things. And we absolutely, I firmly believe that looking at upstream risk and protective factors, root causes, focusing on true primary prevention is the long-run strategy for addressing the challenges that we're facing today. But there is a long time horizon for when you reap the benefits of doing primary prevention work. Yet we still have 110,000 people dying each year. And so we want to save those lives, and we want to create an opportunity to connect those people to treatment and recovery support services. And again, I think we can do all of those things at the same time. And what's interesting is that when I go out and talk to folks in communities, that's how it's playing out, right? It's not, this is my job and I only do this, but it's like my community is suffering and we're going to do these things and we're going to try to make them work together. I think on the harm reduction piece and the prevention side, what is important to recognize is that harm reduction can be multiple things, right? Sometimes it's seen as services or interventions. So syringe services, low threshold access to medications for opioid use disorder, naloxone access, those types of things. But it also is a way to approach people, right? Meeting people where they are, recognizing that people are at various stages of change if they're using substances. And I think the conceptual side of harm reduction is important as we think about prevention in the sense that we want to prevent initiation of substance use, but we also recognize that some people will use substances. And I want to be able to intervene and prevent progression of substance use, but I also want to create the context or norms in a community that we're not setting up kids that if they pass that threshold of using substances, it's not our job. We're not gonna deal with you, and you are on your own to figure it out. And I think that's where, sort of from a conceptual piece, sort of meeting people where they are and thinking about harm reduction in that context creates the trust and safety in a community that if kids use substances and they're struggling, you're creating the context for them to be able to ask for help. And that, to me, is really important, that coming from a place of compassion, empathy, respect is an important piece. And I think that's sometimes lost in people thinking about the interventions of harm reduction versus what's sort of the conceptual approach to harm reduction. But I also think even in prevention, we have to approach the challenges that we're facing now with some new ideas. And I mean, I think naloxone in schools is a great example. The White House and the Department of Education sent out a letter recently saying, like, schools should have naloxone. We were not having that conversation 5 or 10 years ago, right?
That's the seismic shift I was talking about.
But it is a recognition, right, that overdoses happen among this population. We actually see that there have been significant increases in overdose deaths among young people in the U.S. in recent years. And it's a function of what's going on in the drug supply. Because when you look at the overall trends for youth substance use, whether it's monitoring the future data, CDC, YRBS data, and previously NISDA data, you see that historically we have low levels of substance use among high school students in the U.S., yet deaths have been going up. And it really is a function of counterfeit pills, the toxicity of the illicit drug supply. So from a prevention standpoint, we have to take that into account, right? We have to say, all right, so one, we want to raise awareness that drug use is risky. We want to raise awareness that if people are using substances, there are steps that they can take to save their life, like having naloxone. And I don't think that undercuts from our primary prevention role, right? But it is a reality that's the challenge in communities. So I think there needs to be more dialogue on this. So SAMHSA put out a draft harm reduction framework over the summer. We're working to finalize that. And my hope is that it's a framework, right? Then we have to figure out, how does it fit in this continuum? And I don't think any one individual has all of those answers. But as a prevention field, we should embrace that conversation and really think about, what does this mean? What are the tensions? Why do the tensions exist? And how do we find common ground to address the needs that are arising in communities? I think we have to do the same thing for treatment and recovery as well, because there are natural tensions there for harm reduction. So to me, it's a way to say, we have prevention science on our side, we have evidence-based approaches, we're in a new moment. What do we need to keep doing that's working? And where are there opportunities to think in new and innovative ways to address the challenges that communities are facing?
Well, sitting here, I'll say it's refreshing for me personally to know that messaging that I've been giving over the years aligns with what you just said. So somebody who's, a leader that you are, an influencer that you are, as I've talked to prevention professionals on college campuses, I say to them, our first message has got to continue to be non-use. I mean, I know it's not a popular message, but whether it's alcohol or marijuana, regardless of the state you're in, we know it doesn't matter what state you're in, but federally, if you're under 21, it's illegal to use. But for those students who choose to ignore the law, that's where I always came from that point. Non-use has got to be the first message if we're going to change norms and such. But for those students who choose to use, there have got to be services and strategies in place to prevent harm and reduce risk for those students. And that's the fence or the walk that I've always tried to go down, especially as it relates to college and universities, before even nationally we've been having this conversation about harm reduction.
Right. I mean, I think the interesting thing is that in the alcohol space, people have been doing it for a long time, right? Universities have systems set up that if you're at a party and you've been drinking, you can get a ride somewhere else, right? Don't drive. That's a harm reduction message, right? If you have been engaging in alcohol use, don't drive, whether it's legal or not.
Exactly.
Right? I mean, seatbelts, condoms, they're all harm reduction strategies. People may not think of them that way. And for me, what's, I think, a great opportunity in prevention is that we have historically done a lot of work and a lot of funding around preventing initiation of substance use, and then we've done a lot of work around treatment. But there is this large number of people in the United States who are using substances in harmful ways, whether it's tobacco, alcohol, cannabis, illicit drugs, prescription drugs, using them in harmful ways that don't need treatment. What are we doing, right, to address them? So to me, that's a great opportunity in prevention, is thinking about how do we apply the prevention science that we know works to those populations. But harm reduction is also a part of that, right? How do we help reduce risk? If somebody is binge drinking or engaging in heavy drinking, how do we reduce their risk for those harmful effects? So I think there are a lot of opportunities, and I hope people don't shy away from the conversation. It's a hard conversation. There's lots of debate, but we should embrace it because we have to. We're in a moment in which we have to think differently and do things differently.
I was just on a webinar just within the last day or two with one of the colleagues I look up to in the field, Jason Kilmer out of University of Washington, and his mentor was Alan Marlott, who did a lot of work around this. And I know I'm going to paraphrase the phrasing they use, but any reduction in risk is a positive step. And I think that's kind of where I've always been at, but I've never expressed it that way. But I think that is true here. Is it's not intended to be all things to all people, but it needs to find its place in the work that we do.
Right. And I think, so much of the tension and debate is also driven by stigma. Stigma towards people who use drugs, stigma around drug use that is pervasive in health professions, pervasive in communities, pervasive in
it's still
almost
willpower,
all sectors.
Not the brain disease issue.
And so I think that is the other opportunity, as I said, sort of like how are we changing the norms to ensure that we're promoting help-seeking behavior, that if people are struggling, they're not hiding behind that shame because that can kill people. And so I think there is that opportunity to think about these things in different ways, that we want people to be on a healthier path, to feel that they have some agency over improving their life. For some people, that's going to be very small and incremental change, but it's still change, and we should embrace that everybody is not on the same spectrum. I'm a person in long-term recovery,
Yep.
and I knew I needed to do something different for a long time, but I thought, how will I ever tell my parents about this?
Mm-hmm.
I'll lose my job. I won't be able to go back to pharmacy school. And so there were all of these barriers that were driven by stigma and shame to making any positive change in my life. And sort of like, I've just got to figure it out on my own, which was a recipe for disaster because it only got worse.
Right.
And so I think, that my experience is not unique.
Right.
That is the experience that so many other people are facing today. And so I think taking all these concepts, harm reduction, and thinking about how it fits in prevention, treatment, and recovery provides that opportunity to have the broader conversation of what really drives so much of how we think about substance use, right? It's stigma and shame. And it gives us an opportunity to have that discussion and to change minds.
So as we wind up, I always turn the mic over to the guest with this last question around advice or words of encouragement that you have for the professionals working to prevent drug misuse among college students, as well as the students themselves who are watching this podcast.
Yeah, I would say that it's, for me, easy to get up in the morning and come do my job in working in prevention, because it really feels like we have an opportunity to improve the lifespan of Americans, to create something better for the next generation. And I would say for people who are working in that space, especially with college-age kids, there's so much going on with that population, so much transition, so much people trying to find who they are.
Yep.
And I think if you're working in the prevention space, you have a real opportunity to influence and help mold and shape and create space for people to explore those things, but in safe ways, in ways that, they're not going to go down a road that is going to result in their death or some other health harm as a result of substance use. And I would say it's critical, and we need more people doing that. And really, if you're engaging with kids, you don't have to be the professional. There are actions that you can take to support prevention, to support just having a positive influence on young people, on young adults. You never know when you're going to be that influence that helps change somebody's trajectory. So regardless of what you're doing, if you're engaging with young adults, just know that there's a lot going on. They are seeking, whether they're asking for it or not, seeking people to be role models, to help guide the way for them, to check in on them, right? They're in a whole new environment.
Yep.
And I think for students, I would say you're also an important peer to others. And I mean, just things of like being kind, being kind, checking in on people, having naloxone, having conversations about what is actually going on with individuals are also critical things that can end up saving a life. And it may be something that doesn't feel big to you, but it really may be big to somebody else who's struggling. So there is no lack of opportunity for people to be a positive influence on somebody else, especially among college-age students.
Yeah, I love that idea of, be kind. First of all, that doesn't take a lot of effort. But also ask the question, how can I help? And that's sometimes all a person is looking for, is for someone to ask that question, because maybe they don't even know how to express it. But I love that advice, and thank you for offering that. Chris, thank you so much for being on the podcast. CSAP will always have a soft spot in my heart, but I also know, I can speak for DEA, that we've had a longstanding collaboration with CSAP, and we look forward to continuing that partnership with you. As as you've said, we're meeting people where they're at all across the lifespan, and we're just going to continue to do good things to help people where they're at.
Yeah. Well, thanks. I appreciate the opportunity to be here.
Yeah, and to our viewers, thanks for tuning in to this episode of Prevention Profiles Take 5. I hope you enjoyed this episode along with all of the previous episodes. As we get ready to take a month off of December, we will be back starting our new season in January of 2024. So with that, I'll bid you have a great day.